Welcome. Today we're going to talk about different use cases of ChatGPT in the healthcare space. If you're not sure what is ChatGPT, I'm going to give you an idea about that as well. But before that, we're going to talk about specific use cases in each of these areas in terms of what could it be applicable in terms of the hospital area, the insurance companies, as well as pharma and life sciences. What is ChatGPT? It's a conversational AI for that matter. When I look at it from a different perspective, it's a highly sophisticated chatbot because when you ask a question, it gives you an answer. That's how it functions. But when I look at it from the perspective of a normal chatbot, which you might have seen on websites, that chatbot has certain limitations. It'll answer only questions based on the kind of data that it has been trained on. It's possibly not been trained on a high volume of data. But here in case of ChatGPT has been trained on 570 GB of text data. And as of 2021, the internet had 79 zettabytes of data. So when I look at it, ChatGPT has not used all that amount of data. It's only been trained on 570 GB of data. So there is a lot of scope for it to learn as well from a long-term perspective. So let's dive into the specific use cases. We'll start with the hospital use cases. There are two use cases we're going to talk about over here. One is internal medicine, the other is related to medical coding. So first, let's look at what is internal medicine for that matter. The use of internal medicine is pretty interesting. When a physician or when the students are learning medicine, they are supposed to go through a lot of case files. They are supposed to go through examples and identify what is the possible condition for that particular patient. So here in one of the books, I saw this particular case. A 56-year-old man comes to the emergency room complaining of chest discomfort. If you look at it, he was awakened 3 hours before. He was a smoker, 40 packs per year. He had a history of smoking. The heart rate was 116 beats per minute. Blood pressure was 166 by 102. And the respiratory rate was 22 breaths per minute. When I'm looking at it, this is a lot of information and there's something possibly wrong with the heart of that particular patient. I'm no doctor, but from an initial read itself, it feels something is wrong from that perspective. So I gave the same information to ChatGPT. I inputted this information, the same thing, the same text which is there in that book. I put that over there in the ChatGPT, and this is the output it gave. This is the response it gave, which tells you that based on the symptoms, the person has something acute coronary syndrome, which includes unstable angina and myocardial infarction. This is the first line of the response which is there. When you look at the book itself, you go back and see the answers in the book. It talks about myocardial infarction acute. That is the response in terms of the book. So when you're looking at it, ChatGPT was able to give a response appropriately in this particular case. But you cannot be completely dependent. You have to look at a lot of elements around this. This is a paper reference in terms of NLM, National Library of Medicine, which talks about ChatGPT in clinical and translation medicine. So here it specifically highlights that yes, ChatGPT can help in reducing errors. It can help in making decisions, clinical support decisions, right? It can help in that, but you cannot rely on it blindly. You definitely have to make your own assessment as well. It can support you definitely, but you should not rely on it blindly. You'll have to train it from that perspective in terms of what all other elements have to be considered. You do not want to get any negative output from that perspective. So you have to train it properly from that perspective. The second use case over here we're talking about is medical coding. When you're looking at medical coding, if you're not sure what medical coding really is, this is an example of a website called CLAMP. It's a clinical text mining tool wherein the job of the medical coder, the person who does the medical coding, is to extract certain text from the notes, from the clinical notes, and then convert them into codes. Right? That is the ask, that is the task. So if you find any information like mood swings, that should be converted into a diagnosis if possible. That's what medical coding is about. And you might wonder, are there other tools which are there? So if you give you an example, attention deficit hyperactive disorder. The ICD code for that is 590.1. That is what the medical coder is supposed to code for after looking at the notes. And the notes are not limited to only what is there over here. There's an entire text. You can actually go to the site of CLAMP demo and look at that particular tool itself. So that is the ask, that you have to convert this into an ICD-10 code. In a similar manner, there are other codes. There are codes for diagnosis. Other than diagnosis, there are codes for lab. There are codes for medications, RX norm. That is for lab, that is LOINC. You have to code for them as well. It's not that ChatGPT, if ChatGPT is used in this aspect, it is going to be the first tool. There are other tools which are there in terms of computer assisted coding. So CLAMP itself, the demo tool which is there, it highlights the keywords. It highlights what is the problem. It highlights the drug. Over here you can see Adderall is highlighted, Zoloft is highlighted. Even the lab tests are highlighted over here. Depakote, that's highlighted over here. So these tools do exist. It's not that the tool does not exist. But what I did, I just took that same sample and asked ChatGPT what are the ICD codes for that particular patient. And the output of that is very much similar to what I got. Right? It gives me those specific codes in terms of ICD codes. Right? That is what it told me. I also got an output for LOINC codes. I asked the same question, what are the LOINC codes from that particular data, and it gave me a list of LOINC codes based on that information. Again, I have not validated the entire information, but yes, definitely ChatGPT has a scope in terms of medical coding from a healthcare perspective. So those are the two use cases we talked about when you're looking at hospital in terms of internal medicine as well as medical coding. We'll now talk about the healthcare insurance use cases. Here again, we're going to talk about two use cases related to member experience and patient risk assessment. When I'm looking at member experience, what do you really mean by member experience? As a member, you have to note the difference over here when you're talking about in a hospital perspective, in a provider perspective, the person is called as a patient. But over here, in terms of health insurance, the same person is called as a member. And if after the patient gets admitted or after the patient gets discharged, rather, you have to follow up on certain elements. What is the status of the claim, or what you want to identify specific answers related to the patient billing. That is where you have to ask those questions to someone, whether it is related to patient payment billing or claim status check, or even the hospital or the insurance company rather giving a written explanation in terms of what is the status of that particular claim. In this perspective, there are two things which happen over here. This is primarily something which happens in the BPO space. Right? You have a lot of call centers, and people who are working in that BPO space help answer these questions. Whether what is the status of the claim or what is missing in that particular documentation, if anything, right? You have the BPO team. There are people who are sitting and answering those calls, or you also use a bot, a chat bot. The same answers, the same solution could be built by ChatGPT as well. The second example we are talking about is patient risk assessment. One of the most important elements of the health insurance space is identifying risk of a patient and what could be the possible cost of treatment in the future. Here, there is a methodology, there is a coding which is called as HCC coding, hierarchical conditional coding, hierarchical conditional category coding rather. And this is primarily applicable in the US, where you look at Medicare Advantage plans. It is a certain type of insurance. You look at certain conditions, you look at the medical conditions of that particular patient and determine a risk score which helps you identify what could be the possible funding. Right? So these are again codes like ICD codes. So what I did, I took the same data of CLAMP and I asked ChatGPT, please help with HCC coding for the below scenario. And ChatGPT gave me an output in these elements. It gave me the output of this 5, HCC 58, HCC 20, HCC 108. So again, these elements, these codes are telling me what is the risk score. You can actually calculate the risk score based on this element, based on these HCC codes for that matter. And again, I have not really validated the information. I'm just trying to explain the particular scenario where ChatGPT can be used, and this definitely is a good example where it can be leveraged for that matter. So those are the two examples we talked about in terms of member experience as well as patient risk assessment from a health insurance perspective. We're going to now look at specific use cases from a pharma and life sciences perspective. And we are talking about two specific areas. One is patient recruitment and one is medical writing. To understand what really is patient recruitment, you need to understand what is the clinical trial process. And to explain it in a very brief manner, the process is going from drug discovery to preclinical trials to clinical trials, where you have 3 different phases, right? And in each phase, the number of volunteers increase. You have to identify the right patients when you're looking at clinical trials. You have to find the appropriate patients who can be included in terms of the clinical trials over here. The process is lengthy. So the process requires you to identify the right patients. This is based on certain inclusion and exclusion criteria, which is identified based on the demographics as well as the clinical notes. And many times the process is manual, which is why it is costly. So what happens over here is, I'm going to give an example of CliniThink, where they have used NLP, they have used text mining and come up with a solution. So what they did, they used information related to the labs, they use information related to demographic information of the patient, as well as to 200,000 data records of that particular patient. That those are unstructured notes. They built a NLP model on top of that, and they were able to identify patients at an efficiency of around more than 450% higher efficiency as compared to doing it manually. So if I look at it, right, the solution itself, the NLP model itself, can be leveraged to identify patients which need to be recruited from a clinical trial perspective. So a similar solution can be built using ChatGPT. If you want, you can also use the Azure OpenAI, because you can integrate Azure OpenAI. Through Azure OpenAI, you can integrate ChatGPT into your solution. The other example is related to medical writing. And when you're looking at medical writing, especially when you're doing clinical trials or you're doing drug discovery, there's a lot of documentation which is required. That documentation can be related to clinical studies, where you're talking about statistical analysis, or sample study protocols, which includes elements like the study size, the sample size of the patients, what all elements are there, and finally the regulatory submissions, which is a combination of all the documents. And I've just talked about 3. There are a lot of other documents. So from this perspective, ChatGPT can definitely support creating some of these documents. Again, you'll have to give the required information to ChatGPT so that it can build this particular document from that perspective. So those are the 2 use cases we talked about from the pharma and life sciences perspective. Overall, I've tried to cover 6 examples, 2 across each of the areas, from a hospital, from a health insurance perspective, and life sciences perspective. So if you are not sure who I am Harish Rijwani. I have 20 years of experience, all in healthcare IT. I also have 10 years of experience in teaching. I teach health informatics, basic visual analytics, as well as advanced analytics to hospital management students. I'm also a self-published author. I have 4 books. 3 of these are more in terms of the non-fiction category. I have recently published my novel, which is titled 9 to 5 Cubicle Tales. I also have 2 Udemy courses. One is specifically around the healthcare space, which is the same as the first book that I launched, Healthcare IT Decoded. And I recently launched a new Udemy course around storytelling via presentations. So yeah, that's about me. Thank you so much for your time.